All right, we are live. Ebusi ame mo akwaba. Midindi cocoa butter brownie ose chroma hofidua. Paul mama ntem na so me see edikanfo. Freeman Show TV ene midin and ye ha a quick warm up. And same just see e what tamale. Oh, nana tea. Nyame adumo me ho ye na nso e. And some bebre and I ekoso e wo tamale ayaresabia. Na ade ba ko a mehu minister ni kokopie ho no. From my own point of view, no me who say yen Ghana for no ye nipa boni for me pacho say. All right. And inti Minister of Health ekopie ho e watermelon okono wankra. Na ayaresabia de. Esi den and as a minister ba e wo se wo kra. Military fire day. Oh, Charlie, I saw the video. But guy bakokra omunitia pai na can see my or not na. But if that's the case, we can add it to it because this is just 1 hour. Yeah. In fact, yes, I was trying to remember live for 1 hour warm up. Yeah, we need to talk about it because I have the video. Na mean to me fan to because it bimutia pai like hey, I've seen it all. Now, me person me bisa. As a healthcare professional, obi wa how we a healthcare professional. Me person me bisa o ade we a minister yes you apologize. Or apologizing for what? The reaction is exactly what I'm looking for. It's Ghana for no momo po bi a me pamocha ade na mo yes and it's that timid behavior no we don't like it. Ni am na me expecting is exactly what he did and I plug him for that. How can a health facility a fee into what you feel no weekend when you're off no don't you clean your house, don't you dust your house? Why do you have a house help coming to your house? So in a health facility, what is the use of maintenance? Into Ghana for person me say just our practice when we don't know our left and right, we don't know you just we don't know the use of anybody in the hospital. Say oko hospital you were obia in adwuma way na everybody must work to get paid. Because I resabia ye baby and you can see a didi grow. How can say a whole minister or kwakosra or kwakosra ya resabia watermelon because what complain after complain say equipment be bre enye adwuma wo ho one crowd more and obura ho efi and a whole room ya pali equipment e wo say e bia machine bi wo ho battery na wasi edisham na ye adwuma ya pale akosi ho e statistics say phone we na nya adwuma na ye akoto me microphone na nya adwuma na ye akoto ye repair bibia ye wo maintenance go hospital ho so ye tio maka office maintenance adwuma ne so ye dey wo vacuum and that's why dey light here and bulb sha no dey bia bishim oh there be meditamale for hu ya papa and Ghanaians too some mo catch minister of health say on member apologize for what? That is the reaction we need. You see, because of that, when you say, I will call other hospitals, almost 38 clinic, nurses, doctors, whatever, nursing assistants, they are all cleaning, and the maintenance has beginning to fix the equipment. Do anti young country munium bolumo, and some the one who say, Sapiano, BB say, why ye? Anti Bosuni Biano, ain't Sikana ya di mamono for to fixing things. No, what do you use the money for? In fact, Medita Malefon hospital phone we are papa, and you guys have audacity to say he should apologize. He fired the CEO, and I support it. We're replacing the CEO with a good one, and I support it. Doctor now also apology to hell with you, Into hospital now, we feel fear, we require Sabiano. Into how the anything I done, our hospital, over another area, if you know. It is a second new and some private doctor. Amana Oma me and papa yari, no be kufia ko he oma. O hospital ba. No sa de yari san be fie. Me dita malefon we ya papa. Efin. And na equipment bi say, hey, common blood pressure kit keke cramp na ye de be check here no kra ya san enye adwuma tie de akogu ho. And ye want maintenance, eda payroll so, and ye tuaneka. Someone in a man take responsibility say, oh, mind your money and I won't be. With Dumana woman, will take care of a Duman because I know the amount daily better. Average Ghanaian, that's a crazy I have him. Oh, Barbara, now quick, Duma, we will do so you can get paid. And also so that tomorrow you can come to work. Hospital auditors can come to audit hospital at any time. We are Monday. You were Jumana, you won't send for be Casa Bepaki. Auditors, or Pia Yokutana Bad, or Babe what they You understand? You don't need to minister new coins or catch us me, but on patience and son with CC. There be machine say, yeah, it was so Radina Copa. Ain't young Ghana no cry, no here free. Because healthcare before so be school no cry, no training I do femuno. No obi ani ne mraso according Ghana health system say we adwuma na say ebia machine e dey check blood pressure essay ya you need to report it and also a statement now they come out supervisor no supervisor the man supervisor whatever in charge and as a program manager whatever now we taking in charge after 90 days say machine now report to yes I say no manya replacement machine ya fix you must also do another report to your supervisor to also the supervisor say BBA and see after 90 days if the machine is not replaced if the machine is not fixed do you need say when you say also call the higher up now call report to say machine say what report to this is the third time when you want to obi any mraso and now no crime say a just your hospital na obi nurses no obi adwane kan go for me bag ni jane one bra as a nurse as a medical professional and I wonder where he found omo fire omo we school a state border or medical tana ya resabia because according to nursing or see in case of fire you must rescue every patient in the facility yeni mraso doctor nimraso nurse nimraso nurse assistant nimraso traditional just so be nimraso e wo Ghana more catch minister of health say I apologize apologies muni and I'm saying that's where the apology will go. Richard me wakwaba men musu me that say omo bodam cry just will be in the right of Ghana.
I was like apologizing on the basis of what? Okay, fine.
So when you sort you omo Nikasa, did you watch the video? Is there anything he said that was wrong? He reacts based on what he saw.
Is it applied to him as a minister? And now say it is applied to Ubibia or Bekasa doctor and a nurse who are one Kasami Bia. Now, if say Ubikasa Ubi now one Kasami Bia a require for such apology. Doctors and nurses are who patients and people in the arm. So, what is the way forward? And that I mean, say, on some when you visible, send me who frema, send frema to an offer. Let me who many animal cassette gentlemen also on this platform. Eating women, young woman. I will attribute it and say it emphatically. Say, doctors and nurses, or more and a yard some for
we are bro, passport, bro,
hospital. Now, back account. Third one, not ready or survival yet. On only the pandemic, the nurse in the catcher me say, this is the third day I will ban oxygen. So, say, when Tia reacted to it, my yami 2 oxygen.
You see, what do you say when you write to catcher? That is a HIPAA violation. Okay. I believe you. She has no right until say you're pronouncing it dead and so no remove oxygen. Just so be a number.
Oxygen is.
Imagine.
Now, on one casa semuna or call ye now by na akrana casa oxygen, EDBC, maybe say Echina and Bani be free with the Amanusi Sumazo. Now, we said the doctors see ye. Who be ya, dear, any minister react here. We have a bunch of fools.
Say, oh, apologizing.
To apologize on what grounds?
Just say.
Hey, you can't afford it. You didn't sim for you to see a gunya so and rent a kakra.
Jimina.
Doctor Rewa, she do see Casa This just
Time.
And you can't really look into their eyes and tell them, say, we pay you. We pay you. Na enye obia person Kobeba hospital. But as it tell how any near maybe any dini papa hospital. And to say me ba hospital. Na say you be paid because of what you went to study. Na say obe kasa me fun a abuofunu me pere say me ti be bia. Me pere say me na be bia.
Imagine.
Me pere say yade akọ me na be me. Eya me pay. Na Ghana Mr. President, I said no material on the nabe
Charlie. And I mean, as a healthcare provider, me who me say me have facility me team. Ni said the near my juma waha. Now America has a yauti. Now we juma. Now we say uniform. I need so ye juma poor hospital, whatever position you have in a hospital. Now obi da ho. Now we trashy. Osman perform CPR. Me tram. Okra be fire okra. Udu wa be jo bad nya fire. O certificate kra mfa nya adwuma. Masa.
For generation, we never train woman as those people know yes and my idolize you.
Just me to say enche me ko fia kwatrom say the perform CPR the first aid because
it is only in Ghana. In a nurse near hospital and in the uniform upon was that the same uniform in them plumbed in
imagine
instead of obeying. I didn't want to tell something. Look at this. Nurse Nina need uniform now. What they call in an operation room.
Or pass infection anyhow. You see, or the team, it's when him say, "Wow, what's in channel?" Or her patient, or tuberculosis, or benyabi, or her patient, when you flew, or benyabi, when you're riding your coupon, or my band pan, I team. Me that's Richard. Me that's it. You see, be emrano be ye duma. Yen so ayako suku na yeti deno. Ye apply to it. What kind of rubbish country is this? It will be any right. Minister Akko Hospital, no den in Safa. If anything war or then in Safa, come and see dust. Baby, ya koja ya rehe. Minister, Mr. Say, I want to be my best friend. I like the way you are reacting or blasting will be. Now, when him as a minister of health, no, was that me say, Neduma, ye demand on what ye say. Or so when you were Duma, as what? Where you're nursing assistant, what is your job? Or tell will be an Duma in a year. Certificate in a more for jail and hefa. You grassy for Pagana. Me say, near yet, I dare me want to say, over who will be no see my school, my question health and safety. Health and safety, and now, not what if flames at their 2 thing. No one knows you know their 2 thing. Or friend who health and safety, but what school about the trouble fuck is a very different shows at them. But in the health and safety, no, it doesn't apply. No, it's an office. Charlie. DC, me wakwaba. DC, me wakwaba. Me no bema. Nyame adom na nso e.
These days you make me worried because sometimes I just wonder if Sanya Mawe and infection be also. I don't know.
No.
Ghana Nipa.
Oh. Ya bottom. Hey.
You know what? A revolution without actions is useless. And this is why Ghana for painting Jerry John Rollins as a Satan. There was a time when you are in a
Ghana for Asante for the painting.
You catch it and Penfold fear catch it all. Rollins and some church said the year can't Satan or share Bible. Yeah. Now, when Papa cancel once now or catch them Rollins a fast tata and a soldier for tata at the age of 23 of age, a near man now by being a fencing timber that saw me, son a friend of Ghana. Yeah, that saw me. It's like at the back when I say Ghana for I can hear when say being employed, I say to say why in favor say when near Jumana or Management.
Debbie was I say why you now employer and why you favor. Just we will be a man with man our fun. That is how I see them.
You probably put it right.
Because they don't have that kind of yeah.
And yes, a Timamu Fonko Keko, and Crawford took a high position.
Charlie.
And I could find the numbers here so we felt true or born about 10 years ago. And Ghana for the Casa Yakuya Jesus. And that's the whole thing. Chama went to many numbers of CCS or media on the quench in China to matching with because we show video. Now, Shady Chama went to me partners, ya side Nipa Bacope, Sasia, what to me a sign, what you would decide.
Was a yes, I see, oh, mine. Hey.
What you did, Nipa, and what you almost say. One seven, I lecture say, we won't see. I won't mind. Yeah, this year, say, Yendi or Machi Yentia. Look at these guys. Selfish, and I would disem.
Charlie.
Yeah, from honestly, yeah, I think so. Yeah, because what about that? So yeah, we are bubbling now Ghana. Now we are going to free mining.
Thank you. Because you any BA.
No, pay free mining because look, over to your word in Kwasi War, for be a mouse, and that's the whole thing because. Any pa ya bedi mine ni ma ya to abayi omo be juma DC and all that. And yes, omo be diska, omo be say o mine. You kaso be diska. I don't get that. That's not a sikadie. That's not a sikadie. A kwaya and go for faso. I do a minor fast one. And yes, sikadie. But you kaso with diska and it's how we are building. When you see die, Rolling Time, I brought now Ochin Crofono. As Yachin Crofono, Rolling Time, I'm going for one Disica. One Disica, yes, die, and you have to talk cars at it. This guy is now ever say on mine like a gunner sitting at the house is say, but you be a shibia. Ufra Brucheco, your business today. From how you go through that thing.
Oh, yeah.
Business, our Ghana. Opesaya, but I was Opesa Kuhim. Now, yes, man. Now, I think, sir. But the Debbie, I one pie myself, Radimao, Modeni, Uniche. Now, yet you'll be to me because I don't know your calling, but this is beautiful. Rade and Shira, and they were being pie equitable. And now, yet here, see, and you'll be Bijanaha ever treat you.
Aye, what but a mission of cry. Me who na come shop police the amano.
You're from Bonnie, near me, free mobile, I can't. Almost safe phone in a sunny I don't get surprised. She got a new overseas. And I'm me pursue me guy be yes, and maybe say into Germany, you know, any Europe, UK, any Italy, and so somebody be out with the papa you can Jimmy out to the down point.
The more go on it, dear.
Nothing has changed the Ghanaian man in overseas. Yet, nonsense.
Thank you. No, that's it. Aye, why are they?
And that's all we can say.
No, sir. Me that's all DC. Me never Jata boy. Me that me more kwaba na ma virtuous. Jata me more kwaba.
Yeah. Me juice. Me feel say me na make us our beat.
Wa kasa na kasa ese wa.
Program me share ba me jina dia o kan so na me dia ka me dia.
Okay.
Anything Ghana here Corona you feel no. Yeah na kasa no. Make us say Timamu for do do na e wo kru no ye Jimmy. E free how yes if atete because young as are ye ni ma dia ye kru no. Ni ma dia ye dia.
Yeah.
He said Obia as me to say, especially your grandpa, and one my streamers no to make bad life. Omukwana ya make Jimmy Kessiano, to make kind of painful truth. say obi a ye on mine adie na Ralph ehun say adie we a oye enye na obi to me person life it make us say adentina I was saying ni pare to me ko gina kwan no e block kwan as any pan o kasa asem no so wa brochiro but sao no abrochiro no wono photos ada photos na potholes no hu wa kwan no or report CCI e ba be gina ho say ni pan o ko no e na right so betimi a block kwan ni say car at e kwan we mu atu a public road e say abind to all right o be free abind no o be free police so be bo be say ampa akwa no on to make us watch akwa no be gira kwan no ma block kwan say kwan no tu no police ni be ba e de embra na e wo ho na ye juma a kire say ampa sa akwa we de e kwan we say block and say e car and right say or the obetumi de o mind na kra kokko at akogye ni no no yes citizen and the right is up or bomb by say adi we say ya papa toilet we say you clean hospital no and say hospital no hospital is oh my ya na ya timu ye ni ma do ye Ghana ye ni ma do kro ye ni ma do kro say ye ni ma do kro hospital boy ye ni ma do kro your friend of hospital in country ye ni ma do kro hospital na kwa sa ho yare no ko no why you fi
a thing.
Oh, to be fun and go Sadia no crown pono. A broche be no crowd on back of what to say. Pandia Yadia will be much than when the Hase a fee or crown pono what the court what is ready. Pandiana, I sank a wee and gave you a say, oh, what the award you will muja woman and said, what does be mono. The right will be a said that.
And the baby.
And the baby he did. Pandian is a museum for baby and Danum and you're right, even was a compound and so on. Who make us a passenger and I say, who visit an hour calling for your right when you at the moment, you know, who can pick shampoo.
Oh, expose you almost.
What you what we need case, yeah, fan we say when I'm going man as a wabodamo. Sadiana would call Yan was a judges and Casaba became as soon lawyers be so much as a we need case, we billionaire. Ye G at G. I'm a buying so finest at the hospital. They are sad Queenie Pacrono or this Sadia and Babeto one on one.
Just a BB and head more. Near the hazard, I guess you will say a 1 hour wet, men for her, Obetia top, and you mean my Ghana. Oh, clean. This is a hospital now. On a blood pressure kit, now they check out blood pressure, and yet you know. And so next need you send you in him or they are sending us soon in the NY or pump it, Fico, 120 over semi, we only number 300. Oh, baby, Ghana, what do you want to know? Thank you, Jata.
Grass was I say, India or Bibia,
Brony baby, bro.
By a baller. You try a baller, or Brunidian will try a baller. I didn't see that gun at the opposite chair say, you were gun in TSA hospital, a baller.
Oh,
because you were gun in say, yeah, pine, a photos. I bet you take the billions,
so I'm so disappointed. So disappointed in Tamale Hospital.
Facilities, the same scan infant, clean and a cano, opiachi scan on 1 month, and I say, no, Ministry of Health, or what your budget, Jessica said, secure that kind of process. You just 100 billion, say, Tamale, you say, finning and few on the mono. Sikanako show be as a employee, Panasicana, why you feel, Mayan Chilini, Payan Sani, and Cassa, or Nombra, and the patch, or you just
imagine.
Say, if I employ 10 million people, no, Juma, Minister of Sapana, you employ all the previous one, or no, you turn a monthly pay. And
Surgery allowance.
Yes, I get hospital need
sorry.
I do with Jessica will be as young and sign say, yeah, from Baby Yadi, we not buy an ambulance in the bin what she knew when I was see. Right, so
thank you, Jata. Meko virtual. Thank you. It's so sad. Me see the earlier you know taking Ghana say Diano. Nebedu, you better the right thing. Ghana have a long way to go. Virtuals, me more cover.
Good morning.
Good morning, son.
I'm a Bushafuin, maybe say, Obiaho Yanopai. Yada, Obia, so say, Effie, near audited talk by and so Sadanas. That be a one of us. Now, issue about head facility, head minister, the CEO said, strike and I said, seven, and I can see. Ghana
Penocret.
Uti Onabu Akanda, you be a so
there
video. Oh, internet, they say video Obama for Jandam no Emoa. Oh, they say no, be a same baby see a video or video no, which me should be. I should video no. Oko, Obisa, near me, Koso, near Yeno, or admit it, oh my idea. Had ye, see. One thing I'm for a ground cost insure Obisa say, na Adentina, Monu Su, and I no about say no so, no, Asa, ye be. Imagine, or no board and also from da. Into when him say, insure the difficult for Tamele, which the minister admitted, okay, 3 times. Say, no prayer because or no, our head board, no so our parliament, da, or no, da.
Sir.
But won't mean fair also in your excuse because every one and no suggest more say go bet my tankers. And tankers bet me the sooner free baby. Say there a pass of prana second tampon no moment choose you go. Say you fanko we down home country below. Trauma minister by powers of the minister no. It's my tankers I day akofa in free wide. So the fact is, you won't hear the non so interested Nipomu hospital or that's the underlying way. And on a month for video, no,
Omantias, Oman misinterpreting or anyhow.
And a 2 young can of create say you will be as a minister no or 5 years. To say one now, we want a more acquainted, Dr. Moquin, not even. Oba ebisia open in one. Odi eti na asem no ka no. Obia also account there but oni no nyi ya no
interrupting and arrogant. Okano.
Ediabufo na eden.
Ebeba.
Ediabufo ba edin sem bebre beba. Enti no o share ya na honorable Suhini credit na nchen which honorable account o catch and say Suhini. Tobo.
Who say now be crab blinky man a sign, but why not do so on tea?
Eti Emrena, I honorable Suhini Bufu Yakrano. Honorable account on the catcher Suhini say, oh, not upon his shoulders, oh, Toboman on Casa. Eti no, we see you on Pamon Concoyashi. Now at the Juman, no say one, I'm over Juman. But on Casa now, on Casa. Those are the Sabiati, you won't be penny. No, Babbe, too, Nancy Fremont will be some question. No man, I don't see grow now, so
no, Cassa, anyhow.
Disrespect. So, enti asane ba jam dam ne 1,000 Ghana ne yakwajeje no.
Emwa.
Emwa. Ye kan okure no en eye de say tina me say ni oye phone na TikTok no. Video ho nti asem si a se ne wu no no kotie. Oh, one abo anchre disrespect am dey am for say onko pa de chew. Sebe. So kan bi na nya ye jira ha defend dey be ka say o dey.
Okay, Becca. But the good thing is machines are accessed or what is the use of maintenance? End of the day, you know what's not the same machines are there. Ban Ube will say the next government by best pallet you go. One am way and a borough. And you're gonna phone and more high. Ah,
or you from different field. Or your doctor, your minister that
of course,
or your head professional.
Yep.
It will not honor Beccasano. Only God may say problems. So, but say which one among Eban and Epa BB our evidence via and put on buy or now we say I found your paper cry the boy
any but when you prove an answer material and I'm more near my say.
But who can say
it's like nobody cares.
And I can say I see you no besides and I'm on two. Say you was a test organ Obia baby on the settle. It's what
a whole hospital without ICU. So in case of emergency, a hen I'm in panic. Common sense. Then why are you operating hospital anyway? It's a different common phone.
Ah. Okay, and honorable swing crack as I'm saying. Nietma you say, Onipa Babe wo. So ye bisao on life. Only minister in our. These are not the guests was all them because family no clear. Excessive video matter.
Sir,
sir. See, I did your farmer, so I was working such with me from and
on phone.
Minister Mahonoma and found you've not made any course, you've not done anything. Mr. And yes, a minister be copper, you know more castle. Yet to me, and Pamon, and I am found and the
Wapamono. He has every right. When you're arrogant, quite too much.
And I am trust Swahili, English language. It will be our cooking kind article 191 of the Constitution.
Thank you.
You can say public official, minister, and Eddie and Seminole president. Now, President Asher say, and it didn't fit to say, yes, nobody can question.
Thank you. Law no Croman Concosia. Omunkosia law, yeah. A online degree in your printing certificate, make it out because they don't make sense. Thank you, virtues. I stand behind him. It is so sad. Thank you very much. It is so sad to say. Onipa nim se nenkwa ejina hospital. Inti average Ghanaian no. Who nim se we are in our hospital honoma. Hospital facility supposed to be clean. Baby a obekwa ode ya rehebe fie. Ghana hospital. Ukona uba na sad infection aba. Ubeko Ghana hospital aba. Now sad the area. Ebi nipa one ne da ward no. The area na wonya na so say nya because na hospital. What kind of rubbish is that? Now say no as a CEO whatever you are position no bibi nkoso ewo hospital hono. What is your responsibility? What is your responsibility? And you will also fix it. And I say you and the mobile na utu yeah just say you care, you don't give a hook. What one your most sika can say allowance can say not the protocol not the you know man wa kwa broche ni maba. Mo humble lion me mo akwaba. Humble lion. All right, humble. So humble, are you busy, dear? Oh, humble. Okay.
What do you mean? Okay.
Me too. Kapa, me ni abema.
Maybe I think I said that the other say. The minister should do well and fire them CEO, the manager for the health.
He has already fired him, cry. And the people now most supporters on part of they are not from Tamale, so they don't know what they are going through.
It's not enough. He need to be punished as well.
Thank you.
He need to be punished financially. It should be found. It should be found and be what fired as well. Aside that, this nonsense all is because of indiscipline and lack of competency. Indiscipline, I shall see in all the public sector. All the public sector now, from education to the last service, are affected with this kind of behavior. I don't see the competent level of a nurse of being assigned to be assistant when it comes to cleanliness. What is the education impacted on you as a nurse? So also we a nurse. Now on the health sector. Then you should know first and foremost, the primary sector of health is cleanliness. Before you can get healthy, you should be clean. If you are not clean, you don't practice proper hygiene. How would you be fit? You will not be fit. So in the public sector, the nurses that are being deployed to those areas are not competent. They only running for the service.
Thank you.
They're not competent for the job together with the CEO.
Absolutely.
Anybody working in that area, none of them are competent enough for the job. All should be fired.
They should. All of them. Everybody, including pharmacy, will be free uncle.
it's difficult to be fired because they are all being cushioned by politicians. So, in as far as they are being cushioned by politicians, when they allow them, when they fire them, they will try to speak ill to the politicians and their various parties to make them unpopular. So they fear to do the right thing. They fear to do the right thing. So in all, no, our education sector should be thoroughly reviewed. Should be thoroughly reviewed.
You mean our health?
The necessary
you think our health sector?
Yes, to ensure that qualified health personnel, qualified health personnel are being deployed to those places.
Yes.
You cannot deploy people who don't have the job at heart. They don't love the job. They only love the money. Because they are there and they are being paid by the taxpayers' money. So they have to do the job to the best. You understand? So here's the case. They are in there for the money. And the CEO himself is a criminal, a big criminal, sitting down aloof, watching all these things to go on without taking any proper action. Doesn't you know that it's the health of people who are being risked in the hands of him?
Thank you, Humble.
So actually, Ghana, we have a long journey to go.
Absolutely. Thank you, Humble. All right. Humble, 1 minute. I think so. Mommy. Okay, great. You see, anyway, at the end of the show, may I address this issue point by point. Oh, health. Wapomudin, e won hia pa. Baby, akwakwoti apomudin no. E wo say e hot. How do you know, say, walk a hospital, walk check your blood sugar? Next thing now, check your blood sugar. No, we're checking here and say one check it. Okay, Salifu, talk. You unmute your microphone. Mame. Salifu, send me your microphone so mame. Salifu. Yeah, you can talk, Salifu, but unmute your microphone. All right, so untimi unim said is here now corner bra. Salifu, exit and come back. I'll pick you. Kasa, Ghana lady. Yeah, me too, pa. Tamale.
Hospital, Pagana, Abaco Hospital, who
a fin can kind. They have pa, but Obi and Juma.
Because
Mommy, a whole hospital, you need ICU. So in case of emergency, where do you take me? The same maternity ward. And you see, Obi a trash when you you need ICU. What's that? Neglect. Neglect. Negligent. Sorry, negligent. On top baby, on hospital baby. And you must say, Obi and Famo, and sure and run your whole hospital. It's a hospital, doctor here and we're running, sir. Hey, from patient to patient, there's some more room, sir. Now, girls, no crowd, we here. When you say, 25 seconds. Ghana. Oh yeah, no, can Obi cry tap no air bonnet neat. I can say one can no minister in Casa. Will be so question. Or no one can say near cost non as you. Or see, I understand the situation at Tamale, but what have you done about it? Tamale forcing any power. Almost you any po. Almost you a Ghana for. And one Midasi. Thank you for joining us. Salifu, me mo akwa babiem. Salifu, unmute your microphone. Salifu, unmute your microphone. Okay, mommy, as the 2 say woka sabayenti. Salifu, come back why me pick you. Health facility, baby, krobia, very, very important. Years ago, munyina mo ha. And I may call Sanka, me copy mobile clinic, Eddie Abagana. Mobile clinic, no, me frame shows me vision me when they say distance now, they require Sabia and acquire what? Over to 110 miles, 5 miles, just to go for ABI and the high blood pressure and the cholesterol. And I'm Bibisa. It's me, I took it upon myself. Minimi Kunka say sika. And I made a call, yes, and me compare mobile clinic, Eddie Abagana. Senior Beya. Utia we ya obetima ko mobile clinic no na ye de sisi mia gaga enka krobia yo mobile clinic so at this time. That was my vision. Enka krobia yo mobile clinics yo enti say bia we diabetic now feel say you don't feel good sugar was raw. And you can say I feel now better na came and me peka akwa checking me sugar. That is too far. That is totally waste of money, totally waste of time. And you waste your health. Enka mobile clinic no. Okwa nia ya de pin na bo no. Ya check you sugar. Oh papa, mommy, sugar no high. Intend ye ma wodru and na ye wo IB pen. No sugar number form. Or my monitor. No coffee. A walking distance. Walking distance. That is mobile clinic. Use of mobile clinic. Years ago, me frame shows now was a midwife. Said the Messia bre or Ghana. No. Oko district bia. Ye wo krobia me ya to me dim bebre. Why? Because me dedicate my life, my time, and the mommy patient. Many nurse midwife na me timitina moto so e de kokko dia wo. Opa kokko bisa. Kwa de dwama mankranso ne kokko bisa. Metina moto so e de kwadia na light electricity ni o. I'm talking about dentists. Mikuta sa light kania na wo so na wo de ye friend say ye de no ehyem no na wo so na crazy wase no na me kokoduru a me de mabobo ya so sisi wo e na me de agia wo. It wasn't easy. You understand? Polio by me dedicating me time going everywhere, every part of Ghana. Anything I'm me who Ghana baby na me wo polio. You need dedicated nurse for Ghana. You need dedicated midwife for Ghana. You need dedicated doctor for Ghana. You need dedicated nursing assistant. You need dedicated dedicated for Ghana. Nobody. But Kromha, dedicated nurse a reward. Dedicated doctor a reward. Dedicated cleaner a reward. Cleaner will to me ye guma making sure facility near clean. You're born abasu. Yet man employer of the year. Nia bona baso nia na chese wo ye na dwuma yi me my Ghana de o we school no nya adwuma pe book na academ na dwuma e wo so we sell on nya adwuma no Ghana o we school no a doctor me we me ma me papa yin say me doctor ko adwuma not se phone so one man na ekasa onye na adwuma patient bit ma kotena bench so no atena se no twen say doctor ba be hwe ne say doctor no another room hwe patient to we bi akra be ko no wada. And that's what chatty, and that's what the phone. So not patient at that line, not. Oba America, it's not like that. Patient, train doctor is room after room. Doctor Freya, no koha. Doctor Freya, no koha. Situation whereby there's no water in the facility of Tamele Hospital. It's doctor now free room to room. No one and say, "Oh, can also wash gloves." Who names say gloves? No, who go school? You catch say gloves. No infection can be on your nails. And to free down way more. Who run san way free ho. Who free down way more. Hey, me name say me dedicating my time. Na me church momo write about health facility in Ghana. I think I should start doing so because it's like average Ghanaian in Chelsea. As I catch a minister and say, "Omra me pato." Say why must the minister apologize for doing the right thing? One kwamu here, say Oko Hospital, Tamalia, there will be ICU. Say Oko Tamale Hospital, the facility is clean and well resourced, and they have all the equipment. Now, Uncle Juan Cabaden was that situation. Wouldn't Nipa reporting? Some time ago, Omo reportee Nipa and Kwadaya woman Obi a research under any PP era. Did anybody did a research about Tamale and Kwadaya woman over 200 and something? And the Kufuado. Nobody pay attention to Tamale Hospital. Even when you complain, you best have a catch us who complain too much. And then I'll bet me. Am I a minister? When you said doctor, Baba Shawa, or rat them honor, the first knows what you say, or running, sir. You understand? No, a chiao. No better gloves, Eddie Izamil or Izamil. Or Izamil, yeah. And also, you gloves, no, so running, and sound will feed them what they are called. Ghana hospital, Dr. Ben, I'll be my catch and say, oh, work on a hospital, or no, a chiao. On chiao. Ura no abijino and then how no as what check you breathe or check you respiration and one on the way no prescribe do na doctor nya Ghana doctor nya da jinka say we ya dey ya we ya mami take you will be questions no what check mu family history nya ekoso wo busua mu yare bia ye chronic and bibisa and I say genetic know how to tackle the disease there be make us work as a check doctor for adwuma but do the right thing. Because ayana it breaks my heart say me America me kwa adwuma me ye madwuma ye last time me free adwuma I kept 5 minutes na me ba be free adwuma and the patient be raho owura ho ana putupum what hwe ye man ka say I kept 5 minutes enti me be clock out account me David I jump in trying to help get it before say me free on na me di extra 20 minutes e wa adwuma. That is how you dedicate your life for your job. But I me Ghana for teacher ni mfa ho ne na dwuma. Ghana teacher for kwa de omo ya de. At least they go to class and teach. Na nurse for obi a what dispenser akwa nim na dwuma. Pharmacist okona okoje edu say nothing is working in Ghana. Nothing is working. Na some minister area tia ya san be catch and so apologize. Did you watch the video? Were you there? Did you do your investigation? If you see and you're my minister who ye, and it's any I will see question and now or not as a minister of health, no, or say a doctor that or to say doctor they know what they're doing. Uswan my Ghana. Say Uswan. No Uswan my Ghana. Any bad facility or health facility or Ghana. Nothing is working in me, my Ghana. Be near Juma. Hey. Situation now, minister, ni koko PS no. So bad. I wasn't kasabre nyina no. You support minister no, but there be because of say young boy surface interest in tea. How can so be hospital? None as I use blood pressure medication. Kit, they check your blood pressure. Some machine no kra nyadwuma. Now, mammy, hospital, papa hospital, one casa hospital, Ghana. Or say, Bibi Yame, Mayana Makumebo, or see me check your blood pressure, or check your blood pressure, and machine now they check your blood pressure, no cry near you. Tamale Hospital has been operating for how many motherfucking years? Over all these years, Kufuado, this CEO, as a member of a health, our CEO, no. You need ICU, our Tamale Hospital, won't fit Tamale into some I can found. Hey. Free Tamale into one fee say the minister doesn't have a right. Free Tamale and two fees and come, Mama make a bit true. Near Echo Tamale, no, that means say any ICU or Tamale hospital there. That means there are so many hospitals in the ICU. There are so many hospitals machine as I say Google. There are so many hospitals and so near Juma. Not just the doctors now, you guys are passing infection from one room to another. That means nurses are more. You guys are passing, spreading disease all over. You understand? Until your last 2 years, 3 years. No, last year or last 2 years. How many cases you reported and hospital? That say many ICU. You and a nurse nibi a video or blocking and him say we need oxygen. This thing so na esinkanes needed nanim by ya and kiyenedi face the country near Gina said she has every right to. That means we nurse what done adwuma e ye ya say obi banyim abosome nkro no abewo na kwada na because you need oxygen. Are you kidding me? Yenkom send your oxygen kwa no muni o ye need ICU e Tamale hospital. You need emergency department hospital all these years now. Yeah, operating hospital no. You need ICU. Hey. Thank you, Johnny Woods. Stage, Memo Akwaba, 2 minutes. Charlie.
This is what we were wishing for, sir. The best standing up near Kasa, my institutions now. I think, sir, I give thumbs up to the ministers who are yes or not, which one I want hospital or no, or how before you come, and our patient, you come.
Oh.
You might be bringing what you need more institutions. It is our sorry no to Sana Mobia, Yamano, Yatanichi, on your said man. No more is our technocrats now. More no more use to experience just to destroy the institutions. I think so. If possible, they should dismiss them.
He has fired them. He has fired him. NPP Magogo Foka said he has to apologize. Apologize for what?
Yes, idea. The major institutions that collapse. The minister has said, was a passer and they were fight to media to Muswa. Who Kasama Ghana or mine with us. I just came up just to come and thank you for your good work because 2004 may call anonymous show the Sukasi Dabi. See, Taki politicians now, institutions so. I was here cassette institutions no. Institutions no city have no good delivery. My good services. What you say? Yes, sir. You buy cassette go and I think the minister not take upon himself so institutions that be Juma. Look at what the people are doing. This morning I had information said that almost strike.
Yeah, I got information too.
What is all this?
They are crazy.
So I think those who are in charge of the strikes should be dismissed.
Yes.
They should be dismissed from the service. No more say yes in Yabre.
Mr. Dasapa, thank you so much for joining us. Until say Ghana ni on, you bet yes say. And as a Ghana ni be shows when him the right no. You bet cause we see usa, you bet cause we see. It's only Ghana ni free new chrome eba brochura and when him the right. But Ghana ni what Ghana no obi him the right. It be say me bisa mo say nti school no secondary school na obi akọ bikoko duriye no. Ya nkwa nkosua nyansa. You also go invest in so ankwa nkosua nyansa nti burugu na ne dem. Ye be na burugu no musa ne ye ha. Who need more rights? Who go hospital? Na nurse ni kran kasa nchire wo yi a. You must record the nurse, post it out there so that we can fire her. Onim na dwuma. Who go hospital the way is it also no. Hey. Who buy a unit unit no. Unit me wo baby a wo ma empanyufo a wo ma dwen o ma yini na adwen no nheda enye yi no. Wo pede wo de aduane question anim na so se wo mpa. Wo se aduane we mempe. No bisa ne se e dey na wo bedi. Oh, choice na e dey na wo pe. So won't pay way, I remember way, what the way, but not so one panel sanka and say, oh, menu ni make a choice. Maybe come and see treatment, and you know why you're a sabia. Now, as a nurse, what hospital? Now, another way, more facility, not a be a client about patient about or see me tia me ya. What check be you okay? Still, or see, oh, it be going to and what funny as a beer come the dinner bibisa. Yeah, hospital, everybody has every right to eat whatever they want. Woman aduane na se aduane ni sokra na osan wo right so oji bika ho hospital ha and I call bit make just me pe soda me pe coke any fanta me pe sandwich but me my Ghana there because also me mutifo nim the right in tie tuti how I no afa ne sa and a Ghana nurse for mu ade se me no me no react to situation ne ka twom so mu ade now the video ne ba bonten a on be bu ade by force. If you start recording doctor be treat you bad on be respect you by force. Why must you go to hospital for treatment and you come back with infection? Is it then the hospital to make a operation near to make them go stitches any other day? Ever we Ghana ma or me operation Ghana. Ye shani young tantan. I'm what it is there no or baby average Ghanaian or bow or to me in a fuso. Why? Because we in a fuswa ye shut it tantan. Do you know so that's not the right way to do? Ye your operation right there. I could know you know your friend is saying say hi ni na wanya right there baby Ghana there you be power yam ni ase wo yefunu into oba wo Ghana wo tumi nyine yefunu so eno kra mema ni bi wo mo timi gina so di ja wo mo yere because wo say scar kakaka eda ne yam and I remind no say akoda no ko wo no and na me aye ne sa what kind of rubbish is that? Do you know say that's not how they're supposed to do operation? The whole hospital in Tamale, no ICU and nobody sees that there's not anything wrong with it. But rather, no, NPP Magogos, catch and say you have to apologize. Apologize for what? Would apology fix the situation? Would apology create ICU in the hospital? Would apology clean the environment? Hospital supposed to be the most cleanest hospital. The most cleanest. Uba abrocha ya resabia every minute bia. Ura dem no pie ya. Ye won't conform make it better no. Sheet for process to every single. But who average Ghanaian because of say politics said you don't know your right into what anyhow. Hospital can hold fear okay. Because what one with the film. The great. Me mo akwa ba my last call of the day. Thank you.
Oh, Juma dear, oh boy, Juma and Kasa.
That's it.
Oh, Sanka Ubia and Ka. I mean, maybe away, US away and Ka, Ghana. Just a DBC and Kaudi and Kafa, but on my yeah, because Usha, the every amanone. Oh, the every amanone, if I say, Yarsabia, and this and so many things. Nase, Mugana for country say, and can say, then can say, and get a ama or mine. Oh, Munina Mubenya Mutefano. The car, Musi did want. Hey, Nadia was all mine.
Oh.
And this is head of the events, we administrator Emma events hospital. Who the funny say and Kayawa hospital. Wow,
sir.
That's a issue anywhere. Then there's a way. Okay, Mate, it's only hospital or fine. And the Jumedia edition, a binary edition, say, yeah, Busumia, Scala Obeti Busumino, and no Yao say. Nipana omubenda ana so mubewu ana so mu is na tese emfa ho ude e kwan ya obefa so anye nsu a obedware bia na obenu bia na enu de ye Sister Frema.
Oh papa
Mesre o man peni a wa basu sisi no oje institution aya previous government e appoint o ma na se onu kura na wa appoint o no say ejuma no e kosu say enya or using the power no you. I'm telling you, because they're too much. And you're too much. Now, because I say, who did they say, almost this guy, my for say, who did on social media say,
just 1,000 Ghana, just 1,000 Ghana, 1,000 Ghana.
Minister, Tama, Nana, former president, Nana Otunfo, Yamishrao. Sanga Sabi Otunfo dear, or no on special doctors. But a no Diano. What is a yes, you confirm not in Yama, just a Yama be prayer says. Cyprus will not previous government in also. And this Cyprus no more who did then Mutitis Kadima was because of more selfish interest, you know. More than a moody boy said you too for. Let me some. But another more power, oh, Scadia back, Scabba Musamuka crap, and would you see? Just a Ika crab, oh, Sabi and Ika crab because they are Debia. Do you see what Kajetiano? And Lydia Muka can be on more, Muka Chicheska. Obicracy on Yamano when you will see. Hey! And then let's come to them. But Sabreno, Brother Temple, Tema, yet he said, Echo Sama Obi Sabi, I wore Eka Emma, Pevers and the Bay. Sabreno Jana Mutimi, Montimania with the day. Namuna Mua Baimo. Once I said, Asemono Enyamo Ghana with the Esremo, or minor. Mama or mining your first than the party politics no.
Yeah, it's too much.
And I say more NGs and I say MPP. Mama or mining decline. Mama or mining decline. I say more yes. Oh, maybe dear, and me it say the basic beer me them party no.
That's too bad.
Ebeko you and ko you maybe dear me them support. We understand or mining. Just say.
Thank you.
Yeah, dear, maybe dear.
You see? A free. Crowd, what's one of a whole year? One could check you any another letter, bro. Say, also check you any. Every year, also check you. By force, you must go. One qua, you beg a book appointment and I'm a walk. Thank you very much, the great. Thank you so much. Ahana made you no baby see me person me magana phone na asonte say. Or say ye wonyum be say Ghana be ya ne free me ne wo Ghana be ya ne free yenara say Ghana be ye fia. Baby a we maybe I take a responsibility of your juma na enkum nipa. Baby, we no making sure say the right thing is done. That is where you get money to your pocket too. See a minister you call Tamele Hospital no, and was shutting it down and go be a losing juma facility and go be a losing juma. How are you going to cope if you lost your job? People doesn't know the value of their job. People doesn't know. Hey, you forward juma now to tonasi me. I obey juma mama but to tonasi na kaubeti. Media minka so. Me more kwadu we ya de na we ya me point me kana ne we ya na we ya de bia be late o ba wonye de we ya bo so me so a we do see an maka to say no don ensie bio ye nya adwuma ye toto na say ye health system ne baby a e wo see ye nyina take extra precaution ye take responsibility ye making sure that the right thing is done. But me my Ghana the patient a wo kwakoja yaresa no woni mo right. Doctor, koja the right, but he doesn't perform. But then how? How many of you and I did medical error? Yama mo dry wrong. Medical error, ekunkum ni power Ghana. Wrong diagnosis, ekunkum ni power Ghana. Yet ya musician be now bonyum come. The yari. Wrong medication, the man on it's me musician no. Has they been sued? Yes, see hospital na and now doctor yes you no. How say hospital doctor no cry fire no by now. Nothing. Mama take a responsibility of Ghana. Ghana ya minu mi nyina dia. Bibi kosnenya speak out, voice out, record the person, post it out there. Ghana nurses is about time e was say mudi medication e dey come out mo e wo school no mudi adwuma. That is not how you were trained. Okay? That's not how you were trained in the hospital. Before say pass as a nurse, no, you might do practical. Say how I'll be treating patients. Our hospital, but baby, how I'll be seeing Parkers hospital. But me, my Ghana, dear, in your school, they say, hey, near the books not to train your nya and all that no any pay. Now, any pay. Ain't consider bang. I support Minister of Health with 1,000 bags of cement for making such a bold decision, but firing the CEO. Minister Kasana Wokasa, you were interrupting him. And he didn't accuse you, say, why, but rather, or but what have you done about it? You don't want to be questioned. Who are you? Don't you know, say, you are putting people's life in danger? Don't you know, say, people and a woo and a who for the whole at that time, our hospital, did anybody do any research? You need say ICU, you know. The emergency department, ain't you know, ube oko Tamele hospital be woo and no woo. Say, see a minister and a kayano, what the machines are back. You be creating ICU, you be making sure in case of emergency, we have somewhere to go. It imagine, say, what we are, or blood pressure cost so high. No one a year, coma, not be just there's no hey. Oh, Debbie. The earlier, me know me no bet see. You be any, na we are right no. We have a long way to go. So when be when in school kakra na work on, what apply? Who high school? I don't just say unko school. What could be? Who we middle school? I don't just say unko be. What could be? Near one co school done, and it will be a Wednesday day nursery them that, or be a own red school them that, or when you're from say illiterate, and you'll be a waiting middle school or high school. It is school no more what it's more right. And I said they don't teach you your rights. If they don't teach you your rights, what you don't use your phone to do research. Charlie. But anyway, Ghana be me Jidi yes be me worry shemu say Ghana be me worry shemu pass Ghana be. Thank you all for watching. I love you all and I'll see you guys. I'll try and see if I can come in tomorrow. If I don't, Yebeka it was Sunday. Thank you all. Free my fish, what you got for me? Free my don't change my word. Free my soul. Free my 5% so I know. Free my soul. Free my is the better guess I know.
she conquer billions. So anytime me I see this, I get me I see her. I send her from Jah. Now she conquer my life, she always make my day. She's too fine past Gaga. She touch everywhere too bad. Oh. Hey, back up boom boom make me mad. Oh. The finish it be, you know me lie. Oh. This girl go kill me shy. Oh. Chevy, don't make me shiver. Chevy, now you don't make me shiver. Free my soul, free my fish, what you got for me? Free my soul, free my don't change my word. Free my
Eye anakwasem